I'm Dr. Richard Fry, consultant integrative child psychiatrist, formerly a GP, and I've been in practice for nearly 40 years. Today I want to talk to you about Fran, who came to me at the age of about 15 with anxiety. But along with her anxiety, she'd had derealization or depersonalization, where she felt a bit fuzzy and detached from the world and sort of in a bubble. And she'd had some things to try and help with this, including some grounding work to try and make her feel more reconnected. And it helped a bit, but it hadn't really helped with the anxiety, it didn't help with the phenomena. And so she was seeking psychiatric assistance. And the only other things of note were that she'd always probably been more anxious than the average person, had to sleep with her parents for a long time, still liked somebody to be in the room with her really at night to settle. And that she'd had quite difficult bowel problems in that she'd been constipated intermittently for a long time and had to take laxatives occasionally for that. So I took care to check that this wasn't temporal lobe epilepsy or anything like that, because that can sometimes be a presentation of that kind of phenomenon. Rarely, but it does happen. Didn't seem to be that. So a conventional approach might have been to treat her with SSRIs, serotonin reuptake inhibitors such as fluoxetine or sertraline, and see how she went. But before we did that, I thought maybe we'd do some testing. So we did, and we found the following. So negative TTG means that she probably didn't have celiac. It's not entirely foolproof, but it's a fairly strong indicator. And I was doing that because although sometimes with celiac you get diarrhea, you can get constipation. And if her gut wasn't working properly, then that might explain, in the way I work, some of her difficulties with her mental health as well. And the other things that we found were that when we did some more specific food intolerance testing, which is a disputed area, but which I sometimes use, in this set of results, we're looking in more depth at the TTG result for gluten and celiac. And this looks at something like 36 indicators as opposed to one of which is the one we've just seen in the NHS. That was an NHS test, this is not. And she had, you'll see, some red markers which suggested that perhaps all was not quite as straightforward as gluten as it might first appear. But more importantly, when we looked at other foods that cross-react with gluten, she had a huge amount of reactivity going on. So all these sort of alternative gluten-free things that you get told to eat, like buckwheat and quinoa and teff, were a problem for her potentially. And she was also having quite a lot of reactions potentially to yeast, oats, millet, rice and corn. And she also had dairy sensitivity to cow's milk, though not interestingly to some of the milk proteins. So this is not completely diagnostic, but it's hugely strongly suggestive that there's inflammatory reaction going on in the gut. And for me, that's a marker of needing to think about what might this be leading to. So there's this condition known as leaky gut, which means that when your gut's inflamed, it lets things into your bloodstream that it shouldn't. And that can lead to problems in terms of inflammation, low-grade inflammation in your brain. And we know that increasingly there are clear links between inflammation in the brain and mental health difficulties. And then the other thing we found was that we did on a stool test, we found that she had quite a lot of unfriendly bacteria here in the red zone, something called Citrobacter. A few not so friendlies in the middle, you don't want too many of those, and a reasonable amount of supportive and friendly bacteria, but with a couple of low areas which might be important for neurotransmitter manufacture. But the most important thing was the Citrobacter. So what did we do? She modified her diet. She went gluten and dairy-free and avoided all those other things for about 6 to 9 months. And quite quickly within that period, she found that her derealization and depersonalization fuzzy feelings went away. Not unusual, I find, in those kinds of situations. She then needed a small amount of CBT for her residual anxiety. Last time I heard about her, she was doing really well. More soon.